Hi everyone. Our teaching assistant today is Max again because everybody else is asleep. Say hello, Max. Oh, not a happy camper. Okay, so in our second to last lecture, we're going to cover evaluation and its role in empowering not just ourselves, but also our clients and our organizations. So I know in social work, there's not a lot of fondness for evaluation. However, it does more than just entail conducting research. It is also a way of ensuring that we're meeting the goals that we have as an organization and with our clients. And it's a way of checking to see what works from what we do, what we should keep doing, what's not working so well, and maybe we should stop doing. And it allows us to be accountable to our clients, to our funders, and to ourselves. It also forces us to lay out our assumptions and values and examine how they are impacting our client base and our practice. And as such, it's an opportunity to reflect on and promote social justice. Okay, so why do we evaluate? Because it's actually part of our code of ethics in ensuring that what we're doing is not harming people. And what we should evaluate is basically everything related to our practice, including ourselves. We're also going to talk about some of the possible ways that we can do our evaluations and what then results from these evaluations. So I mentioned that we evaluate basically everything about our practice, and that's literally from the very aims of our program, so the goals of what our social work treatments and interventions are, to the outcomes, so what happens with our clients, to follow up, what happens after our clients leave our organization. How do they fare? Do they end up homeless again or using again? Or are they able to thrive? We also evaluate who is participating in the evaluation, whose voices are we hearing, and whose voices are not included. For instance, child protection services, when we conduct evaluations there, we often hear from the child protection workers, the supervisors, foster parents, and occasionally the biological parents. What's very often missing, though, is the voices of the youth who are part of these families and the children themselves as well. And while they might be young, their voices are still very important for learning about the effectiveness and ineffectiveness of a lot of our child welfare practices. And without those voices, we're unable to ameliorate the harms that come from things like family separation and the breakdown in attachment due to family separation. By listening to children and incorporating them in our evaluation of our practices and policies, we can learn about how to minimize these harms. We also want to evaluate our methods, so how we do what we do, and the content, so the questionnaires that we're using, the risk assessments that we take for granted. Are they still effective? Are they still measuring what they're supposed to be measuring? And the textbook very briefly mentions reliability and validity. So reliability is accurately measuring what you're trying to measure, and validity is, are you actually measuring what you think you're measuring? So does your self-esteem questionnaire actually capture self-esteem, or does it capture people's level of happiness on the day that they fill out the questionnaire? So making sure that those aspects of our practice are also evaluated. And we want to evaluate how our time and money is spent. Is it in the most effective and efficient way for ensuring client outcomes, or are there a lot of administrative burdens that are reducing our ability to ensure that our participation in methods are reaching our clients? And we also want to look at how decisions are made within our organization and for the treatment of our clients, and whether the entire organization and its practices is furthering human rights, or if it is ignoring their existence and working to focus just on an individual and not on the systemic oppressions that might be exacerbating their individual behavior, such as, for instance, a mental health treatment plan that does not take into account the systematic racism that an individual might encounter, or substance abuse treatment plan that doesn't take into account the opioid epidemic and its impact on a variety of specific workplaces, including emergency medical technicians, police officers, firefighters, nurses, and how the stigma within those professions might keep people from reaching out for help. So one of the questions that we asked at the beginning was, how do we evaluate? Here's some approaches beyond the standard Likert scale survey. So a Likert scale you might have heard of before. That's where we, assess things on a scale of 1 to 5, where 1 is strongly disagree and 5 is strongly agree. It's very basic. It doesn't give us a lot of detail, but it's the type of information that's usually collected by questionnaires and surveys. Other more detailed ways of collecting information are through informal interviews, so just having conversations with current and past clients and workers. Semi-structured interviews, that's where you might have a set of questions prepared before the interview begins, and small and large group discussions. So these are also known as focus groups or town halls. And in this case, your aim is to collect various perspectives at one time and get people to discuss with each other and come up together with answers to a set of prepared questions. You might also consider doing things like illustrated presentations and skits and dramatizations and testimonials. These are really effective in explaining the client experience of a treatment or an intervention to stakeholders, for instance. An example of this would be having an individual who is experiencing an opioid use disorder to present their story to funders in an effort to humanize the experience and to move it beyond just the numbers. Finn in the textbook really encourages these evaluations to start off simple. So in conversations with clients and workers, ask them, how do you feel about what happened? What worked? What didn't work? And what could be better? So with just these 4 simple questions, you can really get a picture of how an organization is functioning and what some areas of improvement are, but also what is working and should continue to be used. And as well, I want to remind you all that human rights are a very effective way of looking at evaluations, because it forces you to consider the context of our work and how our clients' human rights are being realized or not being realized. So, for instance, the right to a safe place to live. Are your clients actually experiencing that? How does that violation of that human right then prevent them from being able to engage in mental health treatment, for instance, or substance abuse treatment? What's your agency's role in protecting and promoting the human rights of service users? If there is no role of your agency in promoting human rights, what does that mean for your clients? How likely is someone with a substance use disorder to be able to overcome that disorder if they continue to be homeless and your organization doesn't recognize housing as a human right? And lastly, I would just wrap up by saying evaluation is a core component of that just practice framework we've been talking about since the first class. So remember the 5 concepts of the just practice model: meaning, context, power, history, and possibilities. Each one of those is entwined in evaluation. So what meaning does evaluation have for the organization? Is it just something that's done because we have to do it? Or is it something that's done in an effort to actually improve service delivery? In what context does it occur? Is it a very top-down approach? Or is it participatory and invites stakeholders and clients and workers, everyone, to come together and decide how the evaluation will occur? And who has the power to make decisions regarding what to evaluate and which methods to choose? Again, is it top-down? Is it participatory? Or is it completely decided by the funder at the exclusion of the clients? And how has the history of the organization affected these decisions and methods? What other evaluation possibilities exist, and what could you be doing differently? How can social justice be brought into the evaluation process? And where might you encounter resistance in evaluation? We really need to consider how unethical evaluation strategies with certain populations have caused a lot of resistance to evaluation. For instance, there is the Tuskegee syphilis study, wherein Black men who were diagnosed with syphilis were tracked for a long period of time by researchers. However, the researchers let the disease progress without offering treatment when it became available. So this study started in the 1960s. And when antibiotics that could treat syphilis became available in the 1970s, they didn't stop their study and offer that treatment to the participants. Instead, they continued to observe them until their deaths. So as you can imagine, that's a very unethical way of conducting research, and it caused the needless deaths of hundreds of Black men. And as a result, many marginalized portions of the population, including African Americans, are very hesitant to participate in research. So we have to take that history into account when we ask them to participate in evaluations of our practice.